So today will be the first of class requests. Exam Tuesday. I just dropped the exams off today, gotta admit. So hopefully by tomorrow, this weekend they'll be posted. If not, it'll be beginning next week. But we're off all next week, right? At least this class. No lecture till the following week. But once everything gets posted, let me know if you have concerns, questions, whatnot. As well as check your final grade or your accumulated grade too, if you have quizzes or whatnot that are out or in dispute, let me know, please. Okay, but these four, the xylazine and ayahuasca were requested. Kava and kratom I threw in there because they're kind of big now, but we can dive into this. Xylazine is a really big problem right now, along with the coupled to the opioid crisis. But this drug was developed in the early 60s by a German chemist working for Bayer when trying to make a heart drug, something to treat high blood pressure. And as we'll see, this drug does a lot of things. Once it was established, though, they did see that there was some good efficacy as a CNS depressant. So there was talk of using it as an anti-anxiety, a sedative, pain meds, as all of those are. It's currently marketed as a sedative or pain med for animals under ROMPM. The structure itself is where this one gets into all kinds of problems. So looks a lot like the standard tricyclic amines with this 3-ring structure. So very small, hydrophobic, can get across lots of membranes, can bind to lots of receptors. Its primary mechanism of action is thought to be as an agonist to alpha-2 adrenergic receptors. So that usually causes systemic vasoconstriction, but we'll see it has a very unique activity in this space where it causes sedative properties, not just effects on the cardiac system. But due to the fact that it gets everywhere, so has great volume of distribution, it's small, again, hydrophobic. Right, so it looks like here's the base molecule, phenothiazine, base molecule for a lot of SSRIs and now SNRIs. And then its relation to imipramine, very common one in that space. But, so, this hits everything is the issue. It'll hit acetylcholine, serotonin, dopamine, histamine, and opioid receptors. Okay, so a lot of use in a lot of different spaces. So a lot of potential for functionality, but a lot of potential for toxicity too, just as it hits everything. But this is why, quick mechanism of action here specifically, the sedation properties from it are thought to be from signaling at alpha-2. And the idea, so here we have a norepinephrine nerves, okay? Xylazine binding to alpha-2 receptor on the presynaptic nerve terminal causes a blockade of, or prevention of norepinephrine being released from synaptic vesicles. Then the subsequent lack of signaling at alpha-1 receptor on the postsynaptic nerve causes a decrease in norepinephrine tone and then overall sedation and analgesia in this instance, okay? So primary mechanism of action there, definitely its clinical mechanism of action, but again, it hits a lot of different receptors, and that's why it's a big problem on the street now, because apparently it's fairly inexpensive to acquire, and you can use it to cut lots of things. It's used in street preparations for cocaine, for stimulants, for opioids, anything really, just to take up space. And due to the fact that it's such a promiscuous drug, or can hit lots of things, if you have, you have a preparation of methamphetamine that you have xylazine cut into it, it'll actually potentiate the methamphetamine. So you'll get more of an effect of methamphetamine. Same with an opioid. You have heroin, it's cut with xylazine, you get more effect from the heroin due to the fact that the xylazine can potentiate that. So, very useful drug, but also very scary. And this is a big reason why they've shown a lot of potential for this to induce cell death, and not just apoptosis, but necrosis in cells. So we're looking at this study with a potential percentage of apoptotic cells or apoptotic cells. So remember, when you're publishing, make sure you proof everything that you are going to publish with someone who's never read it before. But these studies show on the left, we're looking at cell kill, or the amount of apoptotic cells when treated with different compounds. Excuse me, NC will be our negative control. So this induces, looks like 10 to 20% cell kill in this assay. PC is our positive control. So the positive control in this assay delivers about 60% cell kill. Xylazine by itself is delivering the same amount. However, this study loses a lot of traction due to the fact that they're seeing similar results with cocaine and 6-methyl morphine, excuse me. The 6-methylacetylmorphine, excuse me. So, and these two have very inconsistent results when it comes to just cell-based assay measuring cell kill. On top of that, another confounding factor is they're seeing some sort of protection with the cells. So again, looking at the percent of apoptotic cells, negative control, positive control, but here they're combining the drugs together, and in combination we're seeing protection against apoptosis. So very confounding results. However, we see a lot of real world results that we can compare these two, as a lot of different people coming into emergency rooms with in overdose situations are having necrotic skin. As you can see here, at the point of injection, it will destroy the tissue. After repeated application into your skin, it'll just destroy the skin around there. So, pro-necrotic agent, very scary. There's also some overlap with the respiratory and CNS system. That's xylazine though. Right, and then study from 3 years ago now is showing how much it is making it on the scene in just the last few years. So all of the states shown here in red are where xylazine has been found with people presenting in emergency rooms, and then a couple of scary ones. Philadelphia has shown that over a third of the people coming in for overdose deaths will involve xylazine to some extent, and then in Rhode Island, about 40% of samples of street drugs tested contain xylazine. So, kind of scary. We're trying to get a handle on the opioid crisis, and this is really just making it worse. Anyways, ayahuasca, I should have put this with the hallucinogens, because its primary active ingredient is DMT that we looked at before. But to take a quick step back, this one is unique in that the ayahuasca plant, apparently you can take the roots of the plant, dry it out, chop it up, boil it into a tea and ingest that, or dry it out really well and then pulverize it into a powder and then inhale it as a snuff. Or I've seen applications where actually one person will blow a straw into your nose to apply it. But so DMT was one of the euphoric hallucinogens, but it's more of the spiritual side of things. Heavy with the emotional state, heavy with spiritual imagery and whatnot while on it. But ayahuasca is kind of different in that even though that is its primary active ingredient, there are several other neurotropic agents that do have effects. So As this shows, the primary effects are through serotonin signaling, 1A, 2A, 2C, as we saw for our euphoric hallucinogens before. However, the other ingredients or other compounds in ayahuasca can have signaling at cannabinoid receptors, glutamate receptors, and then within dopamine scheme, both D1 and D2 style receptors can be modulated by this. So increasing motivation and then decreasing the lack of pleasure, decreasing anhedonia, so decreasing the lack of pleasure that you take in life. And this is one that's gotten very big. Last 10 or 20 years, it seems like celebrities that have gone through rehab 3, 4, 5 times will go to these retreats where you can, they're pretty amazing. From what I understand, you can drop about 50K and then you hang out at a resort for about 2 weeks, you wear all white clothes, and then you drink this ayahuasca tea once a day, and it's supposed to really set you back on a regular path if regular rehab doesn't work. But outside of that, yeah, that's ayahuasca. Kava is kind of an interesting one in that it is huge outside of the Western world, but not so much here. In this country, there are now a multitude of different kava bars that will serve this up. So here's the plant itself, Piper methysticum. But picture here, drawings of the plant here. Here's the roots. And this is another one where the root is used either chewed, dried and chewed, or pulverized and soaked into a tea. Provides a mild euphoria and can be a muscle relaxant. Works through GABA-A modulation, as we've seen before with alcohol, benzodiazepines. I've heard it described as you get the same sort of good feelings that you get from alcohol without losing coordination. There's some distinction between this. It's GABA modulation where you can get the euphoria, but you don't get the loss of coordination. Unless you're at really high levels, apparently, but yeah. So the magic from this one are in cavalactones or flavocavanes. These are the active compounds within this plant. Cavain, methysticin, and dihydromethysticin are the 3 main ones. And then these flavocavanes here. So oral administration, obviously, if you're going to be drinking it, chewing on the root or drinking it as a tea. It can get, these are pretty small, lots of hydrophobicity, lack of charge, so they can distribute all over the place. They're worked on by a lot of different enzymes. Didn't list any of them because when I was counting through different claims of which cytochrome P450s they hit it, I read over 7 of them, so we don't need to go through all of that. But then it just gets peed out afterwards, or all the metabolites of this drug. So very interesting kind of drug. It works as an anxiolytic, anticonvulsant, and then a potential sedative. Again, it's just sort of an enjoyable social drink, apparently. But there are potential clinical effects or benefits, as it has been used as a smoking cessation tool, as well as there's been a number of different reports that said other compounds isolated from the plant have been shown to have anti-cancer potential. So there's potential for this drug to be a recreational drug, have clinical benefits, as well as one of the big things is there's said to be very little to no dependence or addiction here. It's, very well tolerated plant and drug with some potential benefits, but as a potential drug of abuse, it does fit in with the CNS depressants, but the mild euphoriants, if you will. So interestingly with this, there are reports that say it can damage the liver and cause cancer. However, a lot of conflicting sort of reports there. due to the fact that looking at real world situations or in the South Pacific where it's indigenous to and where it's used heavily, there's little to none of this reports. I guess I consider these similar to, there was a lot of the same sort of potential toxicity with cannabis about 40 plus years ago, well before the last 20 years of more honest research. And the thought was that in the lab you could show a lot of the cannabinoids have potentially toxic effects. But then, you know, the retort from the pro-cannabis crowd was always, well, if you look at communities like Rastafarian communities use cannabis their entire lives, a lot of people daily doses of it and they have no increased liver disease, heart disease, lung disease than other populations. So similar here with kava. Studies have shown that there is potential for toxicity with this drug. However, real world data doesn't seem to match those studies. Okay, then kratom. This is another one that legal around the states, and then you can find it like kava, you can find it in a lot of different places, but this one is a bit more, kava seems to be a fairly harmless, I might get in trouble for saying that. Kratom is the other way. A lot of people are using this, a lot of people are enjoying it, but there's some serious potential toxicity that needs to be, the society should be more educated on. So Mitragyna speciosa is the plant that produces this kratom drug. The leaves itself are soaked and then boiled into a tea, and people either drink this or usually it's dehydrated down into a powder. But primary active ingredients, mitragynine and then hydroxymitragynine. So the main compound isolated is mitragynine. One of the lesser ones, hydroxymitragynine, is, it says only 2% of the isolated compounds, but this is the one that has the highest potency of everything. But this is used as a stimulant and also used as a potential treatment for opioid addiction. We'll get back to that in a couple of slides. But, so, pharmacology on this is still fairly elusive. Most reports state that mitragynine 7-hydroxy are both full agonists at mu-opioid receptor. However, other reports say that they are partial agonists, shown to have antagonist action at serotonin 2A receptors, so though one of the receptors in the hallucinogenic response, similar effect as xylazine, I guess, with the agonism at A2A receptor. But opposite effect there, so working as an agonist at A2A. And then additional affinity at delta and kappa opioid receptor. And this is where it really gets into trouble. Some reports say that it has agonist activity. Some reports say these two compounds have antagonist activity. But it seems like the modulation of kappa opioid receptors where it really causes problems. So it's listed at low doses. It can have kind of the good benefits or the euphoria, increased alertness, increased sociability, those sorts of things. But then slightly higher doses, or considered high doses, you can have heart complications and then other, lesser toxicities. Above 15 grams is also distributed or also been reported, and a lot of those toxicities follow the same ones that opioid overdoses have, okay? This is the thing. A lot of use in its indigenous area has been distributed throughout the world. There's increasing interest in this drug due to the fact that it has certain psychotropic effects, but some toxicity has been shown again in the lab with heart problems with cardiac output as well as developing cancer. However, the validity of these these experiments really needs to be well established. So as mentioned, primary activity is at opioid receptors. Here we're listing partial agonism at mu opioid and then antagonism at delta and kappa. But it's the kappa blockade that seems to have a problem. There's been a number of reported overdoses, or at least people gone to the hospital after kratom ingestion, and that's where a lot of pharmacologists think the problem is coming in. Blocking the kappa opioid receptor and not allowing for endogenous opioid signaling is causing a lot of problems in these people, and they don't really have it sussed out yet how well or how this is actually working. Mitragynine, 7-hydroxymitragynine again are the two main active components. Extensive phase 1 and 2 metabolism, several different cytochrome P450s act on these. It's orally administered, oh, excuse me. After oral administration, like most, longer latency, like most orally administered drugs. Full effects for about 6 hours, and it's around for about half of that, both of these two compounds. Now, again, confounding studies with this have shown, a very old one from 72 in dogs showed that 920 mg per kg had no evidence of toxicity. However, a study about 15 years ago in rats showed that 200 mg of mitragynine was lethal for rats. Now, obviously these are very conflicting results. One of the explanations in the review on these that talked about it is the discrepancy in producing the mitragynine for these studies. As you have to isolate from these leaves, there's lots of other stuff that comes out, and apparently there's a huge variation in the amount of active compounds in the leaves, which leaves you at, in order to obtain 200 mg of mitragynine, that would mean about 20 to 60, almost 70 grams of the leaves itself. Once it's all dried down, we're talking 6 to 29 spoonfuls of powder in order to get 200 milligrams. So the idea here is that with such a range of material needed just for the active ingredients, you're introducing a whole lot of other stuff in there. So trying to evaluate the pharmacology of this drug while using isolates from the leaves might not be the best thing. Actual isolated compounds would be the way to go. But the last thing, as it says here, the scary thing is that within ER visits over the last 15 years, there's been an increase of the amount of people reporting that they are on kratom at the time. So, Again, the toxicity is an issue here, but the biggest concern is not just that, but the number of different areas of the body that it can have an effect on. So this table is showing on the left all of the different compartments in the body that are affected, then on the right are all of the different potential complications that can arise or toxicities that can arise from using kratom. However, as it was mentioned, there is potential for this to be used as a treatment for opioid addiction. And for that reason, that there are a lot of interested parties in the research world that are trying to develop this, and this is just a screenshot from one of their sites that are trying to develop this and the steps that they feel they need to do in order to really bring out kratom's potential in the medical community would be getting the regulatory and safety issues together currently so that they know what they need to do in order to potentially use this as a clinical tool, and then educating the public and other clinicians about the potential for this. Pathophysiology, therapeutic role, and prospect for research all fall together because they really need to establish once and for all what the pharmacology is of these compounds, and then what if it can or not be used as a drug to treat opioid addiction. Along with that, they can better define how they can do research on this, since there's that discrepancy in active ingredient in the leaves, so making that much more consistent would help these research efforts. And the last thing I'll say that both of these drugs are very popular, or gaining popularity today. I mean, it's we have a lot of different drugs in society now, but they all fall under the kind of traditional roles, you know. So many of the current ones that are a problem are really just different opioid drugs. And even though the kratom definitely has an overlap with that, it's very distinct from traditional opioid drugs. So both of these drugs may have a future for reasons. They have a lot of similarities in terms of inducing euphoria, helping reduce stress and pain relief. They do signal from different areas, but they have natural origin. So this may be something that's coming out in the near future. And we'll see. But anyways, that's that for us. Hope everybody has good things.